There really are three primary goals that we look to focus on. First, when a patient or a patient's family calls in, we have a nurse navigator or nurse coordinator which will take the patient through this whole process from the scheduling of the appointment to setting up those appointments and helping the patient with all the necessary diagnostic tests until a treatment plan is underway, and even through that treatment plan and afterward. The other two aspects that we focused on is what are patients most concerned about when they've gone through this type of treatment in other types of facilities. And the two comments we've gotten back from patients is the long delays that occur from the time that they're aware that they have a mass in their lung until when a treatment plan is formulated, and that's a cause of a lot of distress to patients. And also problems with lack of communication between all the different providers that are required during this process, as well as from referring primary care physicians in the community that need to be kept informed and up to date to help best manage these patients. And so those are the aspects that we've tackled in setting up our system. We have such a nurse coordinator that will hold the patient's hand and the families as they go through this process. We've also focused on having patients, when they call in, we set up their appointments within a week of the time that they call in. We also work to have them seen by all the different experts that we feel are needed to come up with the proper regimen in one clinic at one time so that this assessment can be made promptly. What sets us apart as well as we have both medical and surgical providers and radiation oncology specialists who have both expertise and experience that are passionate about delivering the best possible care to patients with lung cancer. After their clinic visit, we meet in a weekly tumor board setting where the patient is discussed in detail. In addition, we have a dedicated radiologist who will review all the scans. We have a specialized pathologist who will confirm the histologic diagnosis. And a treatment plan is formulated. Our coordinating system then contacts the patient and sets this in motion. And in such a manner, I think we're able to provide really excellent, streamlined care, which is state-of-the-art. At the University of Florida, we have state-of-the-art facilities. We have a new cancer hospital. We have physicians and surgeons with the expertise and experience who are committed to focusing their talents in the treatment of patients with lung cancer. And they're very interested in coming together and working together, seeing patients to streamline their care and to coordinate treatment decisions and to follow through. In addition, there's a long history of research, both in clinical research and basic research that is underway here at the University of Florida. And we look to build on our past successes and to move forward to, for improvements in the future. There are recent developments of the importance of recognizing that it's a complicated disease, and in fact, more information is needed in understanding the biology and genetics of individual patients with their lung cancer. In some cases, this information can make the difference of life and death, and there are specific targeted treatments that are particularly suited. Therefore, it's very important to offer patients state-of-the-art diagnostic and staging procedures to make sure they're taking advantage of all that we have to offer today. And there is a lot of excitement that even though these improvements are still focus on a small segment of patients with lung cancer. We are moving forward to expand this to even a larger group of patients. Being able to participate in this new realm of molecular biology of cancer, these are extremely exciting times, and everyone recognizes that we are in the midst of a genomic revolution, understanding to a large detail exactly what are the genetic and biologic underpinnings of a whole range of different types of lung cancers. Besides thoracic surgery, radiation oncology, pulmonary medicine, and they bring with them, I use the word, I think, expertise and experience, but they probably bring a lot. They have specialized diagnostic and therapeutic skills and tools. Interventional bronchoscopy and therapeutic bronchoscopy through pulmonary, which is very specialized. That we offer here at University of Florida, really as almost a unique modalities. In thoracic surgery, we have from the most aggressive surgical resections, including lung transplantation, to the most detailed, minimally invasive thoracic surgical procedures that we can advise and then offer to patients. In radiation oncology, we are a leading center for providing radiation therapy throughout the country, nationally and internationally recognized. And in addition to the latest computer-assisted methods to safely deliver definitive radiation therapy, there are also precise stereotactic radiosurgical procedures which are being pioneered here in the use of standard care as well as new experimental approaches, how best to offer these to patients that might not be able to receive therapy elsewhere. There's a large patient population base here. Cancer is a major health concern for patients of this state, and so the University of Florida is recognized as really a primary tertiary center, for the state, and we're very cognizant of that, and we work to try to offer the best we can to the people of the state of Florida.